Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. Sniffle season is upon us, and I'm not talking about the cold and flu season. I'm talking about spring allergy season. Juniper, oak, and ash trees are releasing pollen right now as they get ready to bud for summer. And if you've noticed an uptick in your sniffling and sneezing, you may be suffering from a reaction to those pollens. Lucky you, you have allergies.
We love our immune system. It's a great thing for us. It protects us, it helps us. So anytime we come into contact with like bacteria, viruses, things like that that are bad for us, harmful to us, our immune system revs up to attack those to save our bodies. Unfortunately, sometimes that can get a little awry, and that's what happens in allergies. So a substance, or like a pollen, a grass, a weed, even sometimes a food or a medicine, something like that, can come into our body, and our body looks at it, our immune system looks at it, and even though it should be a harmless substance, our body overreacts to it and puts out a response which we see as things that are uncomfortable. So we see things like sneezing, itchy, watery eyes, runny nose, congestion. It can be anything from a mild response, like a little runny nose, to a severe life-threatening response. So basically that's what an allergy is an over-response of our immune system.
Allergy symptoms can range from a few annoying sniffles and sneezes to full-blown asthma. More commonly, symptoms can mimic a cold with sore throat, congestion, and headaches. So how do you know you have allergies rather than a cold? First of all, allergies tend to run in families, so if your parents have allergies, you may too. Cold symptoms usually go away after 10 to 14 days. Allergy symptoms will linger for weeks and even months, depending upon how many substances drive your immune system crazy. You can also take an allergy test. Some allergies can be detected with a simple blood test, or your doctor may want to conduct a scratch test in which small amounts of allergens are applied to small scratches in your skin. If a reaction occurs at any of those sites, then you will know which specific substances are causing your allergic reactions. Treatments vary as well.
So staying inside, keeping your doors and windows closed, using the air conditioner instead of having the windows open, those are simple things. And then of course, if you're out and about, when you come home, at least wash your hands and your face. Preferably before you go to sleep at night, go ahead and take a shower and get all that pollen off of you so that you rest better. So a lot of the things that are over the counter now used to be prescription medication. So we used to have to prescribe Claritin, Zyrtec, Allegra, Flonase. All that stuff used to be go to the doctor and we would write it out. Now most of those that are very, very good choices are over the counter. So first of all, another thing that's simple that's not a medication is nasal saline and nasal rinses. So those are just simple saline rinses. You buy a gallon of distilled water, it's the one with the red cap, put that into a little like a neti pot or a sinus rinse, and the little pre-mixed salt packages, put that up your nose, and that tends to clean everything out. Once a day is great. Twice a day if you're feeling crummy, that's fine as well. But beyond that, the over-the-counter medications that are super simple and easy without side effects, with very little side effects, let me say that. Claritin is simple, it's a once-a-day medication. Zyrtec, simple, it's a once-a-day medication. Those you can give to kids all the way down to age 2. Flonase is a nasal spray. That's a nasal steroid. It's a couple sprays in each nostril once a day. Again, super simple, once a day type deal, and they're very effective. Some of the things that also people tend to like are Benadryl. Now, Benadryl is a lot more sedating, so I generally say if you're going to take Benadryl, take it at bedtime. It'll help you rest. Don't give your kids Benadryl and send them to school, or your teacher will be calling because they're falling asleep on their desk.
If you're really miserable, you may want to consider an allergy shot, but Dr. Singleton advises that you resort to allergy shots sparingly. Long-term steroid use can cause osteoporosis, elevated glucose levels, and can make you more susceptible to infections.
That is a high-dose steroid shot that's given intramuscularly, and it's for the purpose of basically shutting down your immune system. They work great, but they have a lot of side effects, so we don't like to do those. We like to make sure you're already doing the easy over-the-counter stuff, like rinsing your sinuses, taking your showers, avoiding your allergens. Are you already taking Allegra every day? Are you already using Flonase every day? Something like that over the counter. And if you're already doing all of that, and especially if you're already on a couple different over-the-counter medications and still miserable, that would be the only time that we would really want to think about doing an allergy shot with a steroid because of the side effects.
If you'd like to know more about the symptoms and treatment of allergies, visit the San Juan Regional Medical Center website at sanjuanregional.com. I'm Deborah Uroda for Healthy Living in the Four Corners.